So ladies and gentlemen, our next speaker will bring us back to the basic importance. He will share with us why sleep is important to improve our daily life and health. Datuk Dr. Kuljit Singh is now the Consultant ENT and Medical Director of Prince Court Medical Centre since 2007. He has been an active member in the Malaysian Medical Association since 1996. He has also conducted meetings and presented in all the ASEAN countries. So ladies and gentlemen, without further ado, I present to you Datuk Dr. Kuljit Singh.
Good morning and welcome to this series of talks that have been conducted by STAR. I would like to thank them for inviting me here today. My first question to you is, did you sleep well last night? Do you feel that you had a good quality sleep last night? Do you know what good quality sleep is? This is a question that sometimes we ask our patients, and we do sometimes ask ourselves, that did I sleep well last night? I'm going to go through with you certain aspects of sleep. There are certain things that are pretty new to us, new concepts that are new to us, which I would like to share with you today. Why sleep is important? There are many aspects of sleep that we take it for granted. We don't understand that not having a good sleep can relate to a lot of things in your life, in your daily life. One of the reasons that we have seen patients have got other issues when they perform, and even their longevity has been affected because sleep has never been something that helped them during their lifetime. From the time they were babies up to at the ripe age of 80s or 90s, they never had good sleep. And we have seen statistically that when you have good sleep, you reduce your diabetic risk, your emotion and social interaction gets better, poor sleep increases body weight, there is lesser calorie intake if you sleep well, better immune function, improved concentration and productivity when you're at work. It lowers risk of heart disease and stroke. And if you are into athletics, your performance gets better, lesser depression, and reduces inflammation. These are the facts that the medical world have been talking about for time immemorial, and many of times we don't understand why such kind of conditions that we have, it is actually related to sleep. And we don't really focus the importance of sleep. And I think we need to educate ourselves, not just the doctors and even patients, even you. We need to know that these are the things that you need to focus on and go back and look at the sleep pattern and the way you sleep. Now, which are the body parts that involve in breathing, particularly in sleep? Now, the most important structure that we have is the nose. The nose has got only one role. Besides putting a specs on, the other main role is to breathe. Nothing else. You don't eat through your nose. You don't drink through your nose. But you only breathe through your nose. Do we really use our nose for breathing? Think about it. We never realize at times that we are always using our mouth to compensate the nose. Then we have the brain. The brain decides unconsciously whether to use your nose or your mouth. The lungs are involved in breathing. It depends a lot on the air that gets from the nose. If you breathe through your nose, you have more oxygen. If you breathe through your mouth, you have lesser oxygen. And today we are also looking at your dental structure, because the dental structure has got a lot of relationship to the size of the nose that you have. Why I say nasal breathing is important? Because we must use our nose exclusively for breathing and not your mouth. We are meant to be nasal breathers. If you look at babies, babies will breathe through their nose while getting fed. Can you do that? You can't do that. But by nature, we have been trained to do that. The nose is an important structure. Number one, it is natural for breathing. Number 2, it acts as a good filter. There's no other better filter than your nose. There's no filterization that occurs if you breathe through your mouth. It humidifies your air. The lungs needs a particular humidification. It is better than the humidifiers that you buy in town. This is one of the best humidification that the nature has provided. It sterilizes your air to some extent. And most importantly, there are a lot of immune defense within your nose. So now you would understand that nasal breathing is so important. And without nasal breathing, you find that you're going to lose out in all these 5 aspects that you have, that the nature has given us for the nose. So why do we not breathe through our nose, particularly when we sleep at night? Now, there are many reasons why we don't breathe through our nose. Some of the reasons are gender. We find in studies have shown males tend to breathe more from their mouth. We also have females breathing from their mouth too. Age related, the older you get, you find there is lesser nasal breathing. There are studies to show race. We don't have studies in Malaysia to show that. Anatomical deformities, not every individual is the same. If you look at your colleague's face and your face, you'll find that there will be difference. And there is a lot of compromised physiological function whereby that causes us to breathe from our mouth. I have patients who have told me that they have never experienced breathing from the nose and they think that is all right. Posture. You may not realize on your own, but if you look at someone moving with the head moving first before the body, that's what we call the forward head posture. These patients potentially do not breathe from their nose. They have accustomed their posture in order to get the best amount of air through their mouth. Nasal congestion, like allergic rhinitis, sinusitis, are one of the reasons why we don't breathe through our nose. Body weight, if you're obese and your BMI is higher than usual, then you're not going to be breathing comfortably from your nose, you're going to breathe from your mouth. And if you have any endocrine or metabolic syndrome, severe diabetes, obesity, and any other endocrine problems, that you may have difficulty breathing from the nose. It could be neurological. Smokers will have persistent nasal obstruction, which doesn't allow you to breathe from the nose, and alcohol intake, which is excessive. And there are certain medications will also cause difficulties. Now, it is important in this generation that we need to address this issue of nasal breathing in terms of snoring and sleep apnea. You need to collaborate with the ENT surgeon and your dental doctor. Now, if you look at this diagram, our skull is uniquely placed such a way where the nose is actually on the side of, if you look at your skull, the nose is actually placed right above your mouth. And if you have a narrow mouth, that will clearly give you a very small nasal passageway. And if you look at the pictures onto your right hand side, the placement of the jaw has got a tremendous influence on your airway. And those who have protruded jaw, you will find that if your jaw is behind your upper incisors, you find that you'll have a narrow space to breathe. So this shows clearly that there are a lot of dental conditions that causes you not to breathe well from your nose, and neither you will be breathing well from your mouth because of the structure, the way our nasal cavity is and our oral cavity. Why this is important? How you breathe, it determines your face growth, how your body functions. Now, if you go back into history during the hunters and the gatherers, and you look at the current skull structure, it is very obvious that during prehistoric times we had better straight teeth, we have stronger muscles in our mouth. And if you look carefully in these two pictures, on the right hand side, during the industrial era, which is right up to now, you have narrow mouths and the teeth are actually crowded. Most of our patients, when you look into their mouth, the teeth will be crowded, and many a times they go for braces, they do a lot of dental work to give them space to breathe. But that clearly shows that when you have crowding of your teeth in your mouth, your nasal space is actually narrow. As I mentioned to you earlier, the nose sits just above the hard palate, and if the hard palate is narrow, then you're going to have a narrow nasal cavity, hence you're not going to breathe well from your nose. So this is the structure that we have seen, and over 250 years we have noticed that our skulls have become in a very dangerous manner and pretty troubling as far as breathing is concerned. Science has shown to us crooked teeth, overbites, narrow jaws, crumpled nasal airways are modern phenomena. So we have seen that prehistoric people actually breathe better than what we are breathing right now. So we have evolved. If you look at this picture, you could see the arrows that very clearly show the space that you have on the hunters and the modern industrial era. There is significant narrowing, and if you look at your right side picture, the teeth are pretty much crowded, they don't have space to grow, whereas on the left hand side the teeth structures are fantastic. So probably there were no dentists that were required in the prehistoric times, because people at that point of time had fantastic teeth, fantastic nasal airway, and we have lost it now. So the main issue now is not just the nasal structure, it's also the dental structure that you need to expand. There's technology today to expand the upper jaw in order to give you a better space in your nose so that you breathe better. So this is very clear, it has been proven, a lot of studies have been shown how dental structure has got influence to your nasal breathing. So what would be the steps in treating sleep obstruction breathing? First thing is you should consult an ENT surgeon, and the ENT surgeon will have to investigate to see exactly where your problems are. Is it an infection? Is there allergic rhinitis? Are there structures within your nose that obstructs airway? And the ENT surgeons today are also trained to have a quick look in your mouth. They may not be able to treat the structures in your mouth, but then they will come up with a treatment plan, exactly what that needs to be done after investigating. And very often there is cross-referral to the dentist and other specialists to treat your sleep obstruction problem. And the most important would be to review your outcomes after the consultation of these two specialties. This is how sleep obstruction is being treated these days. It's not widely done, but the thinking and the paradigm thinking is now on, that we need to conduct such kind of steps in order to give you a good quality sleep at the end of the day. What does an ENT doctor would do? We use an endoscope. It's a small little camera that goes into your nose. It's pretty painless. It looks into your nose, as I mentioned to you just now. We look into your throat to make sure the structures in your throat, like your tonsils and other structures within your throat, doesn't obstruct your airway. You could be subjected to a sleep study. Polysomnography is a study that's done in the hospital, and sometimes maybe a home study in the comfort of your home to look at the pattern of your sleep and what kind of oxygenation that you get when you sleep at night. Sleep study may not be the only diagnostic tool to answer all the questions when you have difficulty in sleeping. We also resort to radiology studies such as CT scans or MRI to further understand your airway within your nasal cavity and also your dental formation, in order to have a better idea how your breathing is going to be like and how the obstruction involves in your day-to-day breathing. And this is what we do in an ENT setup, and then we will go into treatment. Now, what kind of treatment we could have? Now, the first step is medication. Medication may not be the only complete solution to sleep breathing. We have to treat your allergies, and you have sinusitis. The sinusitis need to be treated because that will give you natural airway through your nose, but that alone will not give you full recovery of breathing through your nose. There are times you need to have surgery, and some surgeries would help you to give you space to breathe through your nose. There will be obstructed structures within your nose, which may not be giving you the maximum airflow to your lungs. So there could be nasal surgeries, there could be sometimes some palatal surgeries, and we do some tongue-based surgeries whereby airway may not flow well after leaving your nose. So these are few surgeries that could be customed for different types of patients. It is not one surgery that would work for all. Having said that, surgeries alone in the nose may not be, again, a total solution for it. You need to probably see a dentist after seeing an ENT surgeon who have completed his examination and his investigation on the nose, and the dentist will look at other parameters such as the level and the height of the palate, the hard palate, whether the palate is too high, and the width of the arch of your upper jaw. And there are devices today which can expand that space so that you have a little bit more extended base for your nose to actually sit on. So such kind of treatments we normally start at this stage when children are still very young. We don't wait for children to start snoring. If you have a child who's sleepy, poor school performance, and if you watch them from far, they often have their mouth slightly open. You should remember that these patients, these children need to be treated early. You don't wait for them to become adults and then you get into therapy, which becomes even more challenging. You will find that children's school performance will increase, they'll get better if these steps are taken early. The final course of treatment would be CPAP, and CPAP would be a machine that basically pumps air in a forceful manner into your lung. Now, we don't say CPAP again would be the total solution. Many a times when patients snore or there's sleep apnea, there would be recommendations made to the patient to be on CPAP. CPAP may be gold standard for sleep apnea, but it may not be a total solution for conditions whereby you're not breathing well from the nose. We can do a lot to the patients without using CPAP if there is a collaborative effort between the ENT and the dental surgeons to give you a total airway to breathe through the nose. This is the new paradigm. All over the world, a lot of doctors are talking about this today. And in Malaysia, we have series of talks that we have had amongst the ENTs and the dental surgeons. There are some dental surgeons and also many ENT surgeons are aware of this condition to treat it holistically. Now, what are the final outcomes we look when you have nasal obstruction, you're unable to breathe through your nose, you snore, you have sleep apnea? First, we want it to be socially accepted. Sometimes we send patients back with CPAP, and CPAP probably may not be socially accepted. Imagine having a machine at night, sleeping, and it is rather uncomfortable to the people who sleep with you and also when you travel. And socially, you should be happy in the sense that you have better breathing through your nose and you do not have any difficulty in mingling with people. And also when you go for trips, your snoring and your nasal breathing, your snoring is less and your nasal breathing is more than breathing through your mouth. The second outcome we look is quality of life. If this condition is treated well, you find your quality of life is better. You don't realize until you get yourself treated, because you may assume that your quality of life is good at this point of time. But if you start breathing from your nose and stop snoring and you have no sleep apnea anymore, you find that your quality of life gets better. That will lead to point number C, productivity. You find that you're more productive. We have seen patients have gone through treatment and they seem to be more productive. They find themselves being more productive, more alert, because they have attained good sleep quality at night. And D, the most important thing that we are worried is having to breathe through your nose well, without snoring, without having sleep apnea. You're going to avoid a lot of non-communicable diseases such as diabetes, hypertension, which later could lead to heart problems and also to respiratory issues, and of course eventually kidney problems. You may have inherited a non-communicable disease, but if you start breathing from your nose well, and this is treated well, you'll find that there is a lower incidence of such kind of conditions in the community that have gone through this treatment. So we are trying to look at three main take-home messages. Number one, your sleep quantity should be at least 7 to 8 hours, but the 7 to 8 hours should have good quality. Just logging in 7 to 8 hours would not be enough, but you need to have quality sleep, breathing through your nose and not breathing through your mouth. That's the most important thing. And of course, that goes to the second point. We have to work towards nasal breathing. You check yourself and you see that whether are you actually breathing from your nose or are you breathing from your mouth, even in your day-to-day activity. Try climbing a staircase, shutting your mouth and only trying to breathe from your nose. See whether you can make the staircase, one flight of staircase comfortably just by breathing through the nose. If you can't, that means you are not a nasal breather. And number three, sleep hygiene. You should sleep at a consistent time. I know we are living in an urbanized area. Sleep is always a privilege. You need to sleep at the right time, get up at the right time, comfortable, with light meals. We like to eat, but don't do too much of eating before you sleep at night, and do your exercises early. And all this together will actually form a good quality of life, and your longevity will actually increase. Message of the day is start breathing from your nose. Thank you.
Thank you so much, Datuk Doctor, for the sharing just now. Wow, I've never realized all this time we might be using our mouth instead of our nose to breathe. So maybe after this you guys can try to check whether you guys breathing using your nose or your mouth. Not now, okay? Relax. Okay, so we have a question from the audience. The first one from William. So he's asking, is teeth grinding and sleep apnea a problem in our sleeping patterns?
Yes. When you grind your teeth, it basically tells you that you are having difficulty in breathing through your mouth. So the reflexes would be that the teeth will start grinding with each other, and you are not breathing from your nose, you're trying to struggle to breathe from your mouth, you tend to grind your teeth. And sleep apnea is definitely a problem in our sleep patterns, because sleep apnea will bring you from deep sleep to shallow sleep, and that episode may occur so many times over the period of your night sleep, between 6 to 7 hours, 6 to 8 hours of sleep, and you are brought into shallow sleep throughout the night. You are not getting sleep.
Alright, thank you, Doctor, for the answer just now. We have more questions coming. So next question is from Didi. How to prevent the open mouth during sleep? Any tool aids that can help to prevent open mouth during sleep? So maybe you can tie your jaws.
Now, in order to treat this, there are devices that are being sold in the market, which basically will try to shut your mouth while you sleep. But it is not easy. It is not that helpful. Many a times the compliance could be poor. So as I suggested, you need to see your ENT doctor to have a check into your nose to see why your nose is not functioning and why are you not breathing through your nose that makes your mouth open. I think that needs to be addressed, and after that you will be referred to the dentist, and there are other ways of solving this problem. Just using mere apparatus is not going to help you, so you need to be tested, examined, if you are a mouth breather during your sleep.
Okay, guys, that's the most important key takeaway. Don't simply use any tools to help you shut your mouth during night. So always remember, if you feel that you have this problem, always go to the doctor, and they will advise you so. So our next question coming from Aileen: did scientists ever found what had caused the narrowing of the oral or nasal cavity we have now? Is there any factors? And will the narrowing of the oral or nasal cavity continue in future generations?
We human beings have evolved from what we used to be. If you look at pictures of prehistoric men and women, of course, our entire structure and our habitat was totally different. You know that we were not meant to stand on our 2 feet. We have 4 limbs, and we are meant to be like monkeys. No, we are not monkeys, but we were supposed to have evolved from primates. And because our structure of standing upright, and we have now got ourselves into a situation, the entire skull structure narrowed by evolution. Can we do something about it? It is difficult, unless you would want to go back on your 4 limbs. That's not going to happen. Now, the important thing how we can avoid it is when we are small, there are many other factors from childbirth, bottle feeding versus breastfeeding, and adenoids, infections when you are young. These are the factors that you can actually avoid and treat when you are young. And that will actually help us in our total facial structure if you start young. Nothing is lost. Even at this stage, if you would want to do some remedial action, it can be done. See your ENT, see your dentist, they will be able to help you.
Yes, again, the message is see your ENT and see your doctors, okay? So we still have more questions coming. So if you guys still have more questions, don't forget to post it in the chat box for WebEx participants and also for Facebook and also Star YouTube. So next question from Masni: is there any effects if we do nasal cleansing, which is using water mixed with non-iodized salt regularly?
It is a good practice to wash your nose using water alone, saline water, or even with a non-iodized salt regularly. But we recommend not to use it too often in a day. Maybe once a day would suffice. It cleans up carbon particles. It cleans up particles that probably have got chemical content from our environment. So it doesn't really help you in breathing through your nose just because you have washed it well. There are a lot of other factors, as I mentioned. Structures within your nose would be actually obstructing your nasal passage. So just cleaning with water may give you some benefit, but it may not be a total solution for it.
All right. So obviously this is a very interesting topic. It's about sleep, everyone's favorite activity. So we have a lot of questions. So next one is from Samson. How do we train to breathe through our nose over our mouth?
It is all in your mind. We have been trained from young. As I gave you an example, when you were a baby, or if you have babies, they can suck on a bottle or on a breast milk. You realize that they can continuously take milk without stopping to breathe through their nose. So we were programmed to breathe through our nose even when we were infants. But over a period of time, because the nose wasn't functioning well, the brain has now directed the mouth to do the job. It is not easy to train. I've done a lot of surgeries on patients there whereby I've opened up their nose, and clinically when I look into their nose, the nose is good airway, but yet they still breathe from the mouth. There are a lot of training. They have a few therapies that the doctors can advise you. These therapies will kind of train you to breathe through your nose, then your mouth, and after some time you get yourself accustomed that the nose is meant to breathe. So there are therapies that will actually help you to reprogram your mind that nose is meant for breathing. It is not simple, but it will take time for you to get accustomed to those therapies.
All right, moving on to our next question from Rickman. How do you sleep better while combating asthma? Does sleeping position or room temperature plays a role?
Well, to sleep better while you're having asthma is going to be tough. Now you have two conditions here. You may have an obstructed nose. Many a times there's allergic rhinitis that goes by with asthma. You have two in one. In order to sleep well, you need to, of course, your asthma has to be under control. If you are wheezing in your lungs and you have secretions and inflammation within your lungs, then definitely you're not going to get a good sleep pattern throughout the night. So get your asthma sorted out. Make sure your medication is optimized for asthma. You will sleep well. Sleeping position and room temperature, well, we normally would recommend patients to sleep on their sides more than sleeping on their back, because there is a tendency of the tongue falling backwards and obstructing. But having said that, this is not something that is easy to do. And room temperature is very individual. There are some who would love the temperature to be 16 degrees or even lower, and they cannot sleep if the temperature is not low enough for them. And there are some who would really want to sweat when they sleep. They would rather switch off the air condition and still sleep under a blanket. So temperature should be comfortable, and room temperature is very individualized.
Alright, let's move on to the next one by Lily. Is sleep apnea curable, or the patient has to be on his or her oxygen machine lifelong? What do you think, doctor, about this?
Well, sleep apnea is curable if it's done correctly. As I mentioned to you just now, if it's going to be on a CPAP machine, the oxygen machine, which what we would say is CPAP, oxygen machine is a little bit different. Oxygen machine is usually meant for patients who are very ill in the hospital. CPAP is a machine that pumps normal room air into the lungs. Now, CPAP will not cure your sleep apnea. But what I had mentioned to you just now, looking into the nose, looking at the obstruction within your nose, clearing and making you breathe through the nose, and also into your dental architecture, that has got more, I would say, potential benefits, and you get closer to curable. And we have some patients who have done very well when they had gone through these procedures, and their sleep apnea, I would say, almost close to curable, or probably they are symptom free as far as sleep apnea is concerned.
Alright, we have two more questions from the audience. So, yeah, also from Lily. Is sinus a start of an issue to your breathing issue, which leads to unhealthy sleep?
Not necessarily true. There are lots of patients who do not have sinusitis, but they still have unhealthy sleep. Sinusitis could be part of the entire game plan of having an unhealthy sleep. Even you may cure your sinusitis, treat your sinusitis, patients may still have unhealthy sleep. So sinusitis is something that you need to treat in order to have a good nasal breathing to make your nose function well, but that may not mean that it's going to give you good outcomes as far as your sleep is concerned. So for that reason, there are a lot more than just treating the sinus. You also need to look at other aspects, as I mentioned to you earlier, your dental architecture.
Alright, we have come to the final question from RJ. Is regular use of melatonin safe?
In my opinion, melatonin is not something that you need to use regularly. The most important habit would be to get back into your normal sleep rhythm. Melatonin is usually used if you're a frequent traveler and you have difficulty in getting back into your normal sleep cycle. I would not recommend that melatonin needs to be used in a regular fashion, and it is best to do with your natural way of getting into sleep. There are a lot of ways of regulating your sleep pattern. As I mentioned to you earlier, fix timing of sleeping, and do not eat too much at a particular time. And there are a lot of things that in the modern generation that we do, watching television, looking at iPads, looking at your computers before you sleep. These are the things that actually causes your natural melatonin to go out of normal control. So my advice is regular use may not be so good.
Alright, thank you so much, doctors, for answering all those questions. So the biggest key takeaway here is we always have to practice good lifestyle, as well as to always seek doctors if you are facing any problems. So doctor, before we end this session, do you have any final words for our audience?
I think the important thing is today in our difficult lifestyles that we have, and furthermore we have the normal norm, many a times we forget that we need to look out at our breathing pattern. Breathing pattern is usually kind of neglected. As long as you can breathe, you feel good, you walk around happily, but not realizing that these simple things like breathing through the nose, that you have not realized that you are neglecting it. And there are a lot of benefits of breathing through your nose. And when you start breathing through your nose, you find your total longevity and your quality of life will improve tremendously. So my advice is, start thinking, am I breathing from my nose or am I breathing from my mouth? You can try it out on yourself today.
Alright, that's a wrap for Dr. Kuljit's session. Thank you so much, Doctor, for joining us here today. So guys, we'll be right back with a panel discussion. So don't go anywhere, don't sleep yet, okay? And see you guys right back. Thank you. Stay tuned.